Hello, I'm glad to present my papers here. I'm Park Gyung. I'm of Catholic University Neuroscience professor. My paper's subject is the relations of critical thinking disposition, nursing professional value, and satisfaction in clinic practice of nurse students. Let's talk about the necessity of the research. First, the purpose of nursing education is to educate capable nurses with extensive and holistic nursing knowledge, experience, skill, and especially clinical practice education is a prerequisite of course. Because all nursing students in our countries they have to perform not only theoretical education but also over 10,000 hours clinical practice education. One of the indicators to confine and whether the purpose of education is satisfaction in clinical practice. And to cope with various clinical situations, critical thinking is demanded for nurses. It is the key factors that positively affect the ability of solving problems and performing properly in situations. And furthermore, it is required to establish the nursing professional value in order to efficiently perform the task as a professional nurse. In a decision-making process, to solve the problems encountered in various and complex clinical fields. The more positive the nursing professional value is, the higher the job satisfaction and the lower the turnover rate. The Korean accreditations, the board of nursing education, to also emphasize nursing professional value on indicators of educational accomplishment of nursing students. Let's talk about my studies purpose. The purpose of my studies was to verify factors that affect satisfaction in clinical practice and the relationships between critical thinking, dispositions, and nursing professional value and satisfaction in clinical practice. Let me talk about my research methods. My study was descriptive studies, and the subject of these studies, nursing students, the undergraduate, the first grade, 281 students. And I used the measurement tool, the 3 measurement tools. And for critical thinking dispositions, the measures by 27 the item and 29 questions the item surveyed for nursing professional value. And satisfaction in clinical practice measures by 31 question items. And my paper's data analyzed by using SPSS win 22%. And t-test, ANOVA, and Shepherd test was applied for first validations purpose, the Pearson correlations, and multiple regressions. Let me talk about my research, research. First, correlations between critical thinking, dispositions, and nursing professional value and satisfaction in clinical practice of the subjects. There are three variables are significant static correlations between the satisfaction in clinical practice and both critical thinking disposition and the nursing professional value. And also the significant static correlations to response to visit in critical thinking, disposition, and the nursing professional value. And factor analysis, like by multiple regulations, factor that affect satisfaction of the subject in clinic practice. Let me talk about conclusion. My study analyzes the correlation between critical thinking, disposition, nursing, professional value, and satisfaction in clinical practice. Indicates the existence of a significant static correlations and between satisfactions with clinical practice and both critical thinking and nursing professional values. And also, the factors affecting satisfaction in clinical practice are nursing professional value and religion. Therefore, I think satisfaction in clinical practice to nursing students can be enhanced if intervention and educational programs to perform nursing professional value are developed and applied appropriately. Thank you so much.